Well, good morning, everyone. My name is Cindy Cheswick, and I'm going to be talking a bit about a case study of a family that I treat, a person with some gambling-related harms and how the family is also affected. It's a journey through gambling addiction and recovery. So first, a little bit about me. Again, my name is Cindy Cheswick. I'm a graduate of the University of Cincinnati. I received an addiction studies associate's degree in 2006 when I was doing pre-social work. And then eventually 2013, I graduated with my master's social work here from the University of Cincinnati. I'm an LISWS and I'm an LICDC currently in supervision for CS. I did get the GAM endorsement to be able to be presenting here today and treat those folks in the community. And then I'm an LICSW out of Arizona. There was a shortage of us during the global pandemic, and I went ahead and got licensed in Arizona so I could treat some folks out there as well. I was working for a company that did some, we tapered folks from opioids and benzodiazepines. So there was a large number of referral sources out there. So Brighter Days Wellness and Recovery is the company that I established in 2020 after some experience that I have had with both sexual and financial exploitation in the community. I'm also a chair of the Community Outreach Committee here at the Problem Gambling Coalition of Southwest Ohio. I hope you can join us sometime. Also 2024 PGNO Fellowship graduate this year. And I have current student for the BSW field placement this year as well. So moving along, that's what brings me here and gets me super excited about being here. Now, I went ahead and I got that GAM endorsement. This is one of the reasons why I got that GAM endorsement, because back in May, you can see PGNO set up the Problem Gambling Network of Ohio, if those of you who don't know, set up, this map that shows all the folks, the treatment providers that are available in the state of Ohio to treat disordered gambling. And by county, you can see all of the red spaces that have 0. And I know every day we are updating these. So that's what brings me here and what brings me to you and to train you and to show you how many folks are actually out there that need us. So let's move along. We've got, this shows a little bit of the data, the background data of those folks calling into the helpline. The helpline will also be available at the end of this presentation for you to spread around in your communities as well. But we can see Cuyahoga, Franklin, Hamilton, Summit, and Montgomery counties, the helpline calls that came in per county, and then how they are also increasing over time. So we're going to go ahead and move into today's learning objectives. So today, what we're going to be doing, focused on, excuse me, I'm going to move this up so I can see just a tad. Ooh. All right, so today we're going to be focused on gaining insights into therapeutic techniques for compulsive gambling. And we're going to be doing that by focusing on the techniques that I'm using today. So you're going to be able to pick out the cognitive behavioral therapy practices that are applied in this case study and motivational interviewing techniques and why we would be doing those in the compulsive gambling field. We're going to be able to recognize the psychotherapist's role in family dynamics. We're also going to be able to explore real world challenges in treating compulsive gamblers, because we know there's always real world challenges to deal with. We can put these case studies together, but until we actually are treating folks in the community, knowing what kind of challenges that they're going through, we're not going to be able to really know what's going on and how to treat these folks. So originally, the client that we're studying today came to me April 15th, 2024. He male, 50 to 55 years of age. He's self-employed. He's never been married, no children, no pets. He's a homeowner. He is a college graduate, and his annual income is between $75,000 and $150,000 a year. He came in as a self-referral based on the family member that is also being treated in my practice. who called the problem gambling helpline in the state of Ohio, which means that is so needed for us. So some other background on him is that he has no other physical health issues other than having a bit of excessive weight, excess weight on him. There's no diagnosis there or diagnoses. He suffered some grief and loss from his father's death in 2021. He comes in suicidal into the appointment in April. This was an attempt to take his life with car exhaust due to his gambling issues in 2021. And then the most recent one, he was planning with intent with lethal means because, again, of gambling issues. So I'm so glad he's here, and I'm so glad we're studying him in this case. So he also comes in with anxiety-related stuttering issues. As he gets anxious, he starts stuttering. And this has been going on his entire life. And there's never been any treatment or diagnosis based on this issue, but you can tell that it is directly linked to, because the more anxious he gets or the more processing he does, he starts stuttering more, and we have to stop and do some techniques that we'll go over later, and I'll show you what those are to help your clients. It helps him when I'm working with him. He denies any substance use or process disorders in his lifetime. He does report that he drinks alcohol socially, and what that means to him is it's maybe 1 or 2 drinks a month, and that's about it with friends. And that's been his history that he's reported. He has a lack of motivation right now to go to work. He's never been to therapy. He's had no previous mental health diagnosis, and he's never been on any psychiatric medications that he's reported. Now, again, we have a family member that we're also treating in this case study. So the second client is a self-referral, again, from the problem gambling helpline, who called because they were in distress because of client number 1's suicidality. That was what really brought them in. So this is a female, client number 2. She is a Caucasian female, 75 to 80 years of age. She's been divorced twice. She's single currently, no pets, and she's retired. She doesn't interact with friends a whole lot right now, so she's doing a bit of isolating. She's never been to therapy as well. She has positive family support with 2 adult sons who, one has some family that she is close with. And she loves to golf, but she hasn't been able to go golfing. She reports due to just not really feeling well. And it's because of her symptoms as we get to know each other and as we talk. So she lives in independent community. So she's very active. She drives, she can cook, she can do everything for herself. However, she's not been mingling with that community very much. She has no previous mental health diagnosis either. She is comfortable financially. She takes lorazepam for sleep, 0.5 milligrams, and it's not currently effective with her sleep quality or hours of sleep. She reports using no substances. She did drink a glass of wine about every day until this started happening, reported of the gambling related harms that is, and these symptoms that we're going to go over. Because she started taking Prozac, she has now went to the psychiatrist and she has started some Prozac for her symptoms. So she discontinued the wine use every single night because that was recommended by the doctor. The other thing that's important in this case is client number 2 is paying for client number 1's treatment at a 50% reduced rate in order for these folks to come into treatment. I am Brighter Days Wellness and Recovery, which is a private sector business and does not get any funding from the state or from the government. So I have to come up with creative ways to be able to work with folks. And this was half price and letting the family member confidentially pay for that person. But we'll get into that a little bit later if we need to. Kind of into the assessment now. What did we do? How did we assess these 2 folks? So client number 1, because obviously he was high risk, we used the Columbia Suicide Severity Rating Scale with him. He was high risk. We used biopsychosocial full assessment. to find out everything we possibly could about him and how we were gonna go ahead and help him. What was our plan gonna be, along with what his goals were. We also used safety planning right away because again, he was planning to harm himself. He did have lethal means to do so, so we right away got busy in removing all of those things, verifying those things were removed, and it was all in safety planning and it's all documented. He takes that home with him and we check on that any time that we meet. So we did the SOGS, which is the screener for pathological gambling is what it's still termed. He did score a 5, which was into that probable pathological gambler screening. So we did the PHQ-9 for depressive symptoms. He scored a 17, moderate, severe, and it was severely affecting his functioning, all of his symptoms he reported. We then moved on to the GAD-7, which is the anxiety screener, and he screened at a 12, which was moderate anxiety being experienced, and it was somewhat bothersome to his daily functioning. We did the mental status exam because that's always important every time you meet with somebody to get a clear picture of how they're functioning and if there are any cognitive issues going on that you can be aware of or need to be aware of. Stage of change that he comes in on, he is already in action. He's already scheduled an appointment to go to the psychiatrist. And he has talked to his mother and his other family members about these things. So he's in action and he's ready to stop his gambling behavior at this point. Okay, client number 2, we did the biopsychosocial assessment. We did the PHQ-9. Depressive screening. Again, it was a 13 for client number 2, and it was moderate depressive symptoms, and it was very much affecting her daily functioning, she reported. We did the anxiety screened at a 10, which was moderate anxiety being screened or experienced, excuse me, and it was very much affecting her life. The functional assessment we used with her because I wanted to see and show her every 2 weeks with a continued clinical questionnaire assessment that she was going to get better, that she was going to start being able to play golf if she wanted to and get back to her own life. So she screened at a 16, which was worse than she had functioned 2 weeks prior. We did the mental status exam again with her because it's always important that we see the picture of what's going on in front of us. Cognitively, she was having no issues there. And then stage of change for her, again, she's sitting in front of me. She's already scheduled a psychiatrist appointment and she's ready to treat her own illness, her own symptoms. So here's the problem, right? I talked a little bit about some of the problems so far, but what brings them in? Client number 1, again, he's our person who's experiencing these gambling related harms. He's depressed, he's suicidal. He reports that he has a gambling addiction. He reports playing slots, and then he goes to the casino to play these slots. He reports 2 times that he's been struggling with this, and he's experiencing isolation and loneliness right now from this. Anxiety is causing the extra stuttering. He is aware somewhat of the connection, but is not aware that the gambling behavior has anything to do with anxiety or the stuttering. So we're working to help him and increase some insight on that. He has lack of motivation. He's not going to work. He's self-employed, so he still has his job, but he's just not scheduling as much work. He denies any history of trauma in his lifetime. However, he has had grief and loss. He does not identify that as trauma. He is experiencing insomnia. He's not sleeping very much. And when he does sleep, it's not restful. And he's coping with everything in his life with gambling. He has unhealthy financial habits. And some of those look like he's not paying his car insurance. Even when he has the money, he's not cleaning up his home, even though he has the time to do so. He's just not able to. So right now we've got client number 2 and what the problem is for her. She needs support over this family member struggling with these gambling related harms and suicidal thinking and planning. I can only imagine how it would affect me if somebody in my family was dealing with those situations or those symptoms. She's dealing with isolation, you know, in her community. She used to be a volunteer, with a local, mentorship type of company or agency for children, and she's no longer doing that. Not only for this reason, but this is the reason she hasn't gotten back into it. She's also dealing with constant, you know, stress and worry over client one. Lack of motivation to enjoy life, as I said, and do the things that she wants to do. Also finding a new church, and she cannot get any restful sleep. All right, so there's a little bit more gambling history for client number one that we want to go into. So he reports that he's been struggling for 6 years with these gambling behaviors. He reported a big win, which we know is one of those factors in the early grabbing of the chemicals in the brain of us to go back. So he reports winning about $6,000 on slot machines, and he chases wins and losses both when he comes to me. He lives 2 miles physically from the brick and mortar casino in which he goes to. So that is a huge environmental factor for him. He started going more often after his first big win, because he's reliving that first big win in his brain as he's sitting there at the same type of slot machine that he won at before, which is another one of those cognitive distortions that our brain plays with us. And we'll go over that here in just a little while as well. So he started going more often, like I said he spent all his extra time and scheduled less and less service calls for work. He calls his work service calls. So now he's spending more time and energy in the casino at the slot machine trying to win the money that he could be actually out doing the work for. And he's not seeing this creep in little by little. He's lying to hide how much he's spending, how much he's winning, how much he's losing, how much he's going. He's attempted suicide twice. Very lethal means. And he's planning with very lethal means. So this is a serious, serious case. His gambling behavior increased after a breakup, which was several years ago, and I found that out later on from the family member actually dealing with some of their stuff. But father's death also in 2021, which pushed us into identifying the pathway that this gentleman got into, that he got into this gambling related harm in this situation in the first place. And we'll go into that a little bit more. But he also is watching between 4 and 6 hours of YouTube and what's going on YouTube is he's watching other people play slot machines for entertainment. So he's not going to the casino right now because he's here with me, but he's watching it every day, getting that same chemical stimulation in the brain. So he's also had some sexual behavior triggered, but not explored in the gaming environment. It correlates with there's other factors that can happen within the gaming environment. And for him, he did mention some sexual behavior was triggered, but he wasn't willing to go into that. So we just listed that as history of his behavior. So he's also tight with money when it comes to living expenses. Again, he's late on his responsibilities. He's late on his house payment by 3 months, even though he has money, and he has money to go and pull from, but he's not touching it. And it might make a little bit more sense as to why he's not touching it later. But what we did with diagnosing on these first 2 clients, right, or on these clients that we're working with. Number 1, gambling disorder, moderate. When he is diagnosed, I know a whole lot more about him later on, but originally it's gambling disorder, moderate, and it's persistent. Major depressive disorder, reoccurrent and moderate. We're going to rule out any anxiety disorders. He's got some hoarding behavior and some other anxiety related behaviors like the tics and the stuttering, things like that. We're going to pay attention to those. They could also resolve as his symptoms resolve, right? Because this could be a symptom associated with what he's going on or going on with him, or it could be an independent diagnosis, which we have to figure that out later. So client number 2, she is dealing with insomnia. She's dealing with generalized anxiety disorder right now. And she's also going through adjustment disorder with mixed anxiety and depression because of this acute situation. There's no rule out at this point with her. Again, that was in April when I first started working with these folks. So diagnostic criteria, just to kind of let you see this, outside of the book, right? Gambling disorder, moderate, persistent, is unsuccessful attempts to stop or control gambling behavior. And it's an escape from their problems. They're chasing losses, relying on others for financial bailouts, preoccupation with gambling. He's thinking about it. He's watching it on YouTube. He needs to gamble with increasing amounts of money. You know, if $6,000 was the start, we don't know where he went. He's talked about a lot of different denominations. So jeopardizing or losing important opportunities. So he's not going to work. He may be losing opportunities there. He's also losing opportunities or affecting relationships, you know. Major depressive disorder, recurrent, moderate. Depressed mood becomes loss of interest or pleasure in almost all activities, sleep disturbance, low energy, recurrent thoughts of death, excessive guilt, impaired ability to think, concentrate, or make decisions. Now, I don't have him diagnosed as severe, even though it seems like he may be severe coming in with these suicide attempts, but he was removed by 2 weeks from them when he got to me. So he was already a little bit decreased from what he had been in the, or de-escalated from what he had been when he first had this situation 2 weeks prior to coming to see me. Okay, so client number 2, you know, I just wrote or put down what the general anxiety disorder criteria is. She is dealing with constant worry and she can't control that. It's keeping her up at night, causing her a lack of energy. She can't think. Her mind's going blank. She can't then get into the daily activities that she wants to do, like her golf and playing jigsaw puzzles, getting back to mentoring. Adjustment disorder with mixed depression and anxiety. Depression was not a part of her life in her self-reports previously. So these are all as a result. And we're hoping that this adjustment disorder, right, with mixed depression and anxiety resolves. That's what that diagnosis is about. This is about the acute situation and how it's affecting her and her life. All right, so goals of treatment. Client number 1, what he wants to do is enjoy eating good food. He used to like going to a pizza place that he specifically enjoyed in his area, and he hasn't been able to go there. Not only not enjoying the food for just the palate, but the money. He doesn't want to spend the money anywhere else except for at the casino on these slot machines. He wants to sleep better. He wants to be able to laugh, not to think about wanting to die. He wants to be sober from gambling, at least for now. Not long term. He doesn't know what that looks like. He just right now wants to be sober from gambling. He wants to play golf. They're a golf family. He also loves to play golf. He is not extremely competitive in golf like his mother is, like the other client is. But so he wants to be motivated for work. And his quote is, "I just want to be like my normal self," which are these things here. That's what he wants to do. So client number 2 wants to be more social. She wants to enjoy life again. She wants to relax without always thinking about what's going on with her family member. She wants to have better sleep. She wants to be in touch with herself and not to be in a tailspin, which is releasing from worries and anxiety that consumes her. And then get more support, you know, from people who understand, besides just me as the professional treating her. So treatment planning, here we get to this. So client number 1, we want to return him to pre-crisis state. And although he comes in 2 weeks after his suicide attempt, he still has a ways to go to get back to his pre-crisis state. We want to create a schedule and structure for him. We want to maintain routine and manage urges. We want addiction strength training, which is strengthening those neural pathways that we're going to create in that brain that have been laid right now by reinforcement, and we're going to go over what that looks like and means, by constantly going back to this gambling behavior. We want a medication evaluation to balance out dopamine, serotonin, or what's going on up there, combined with psychotherapy, because we know that the combination of the two, research supports that is the combination treatment that works the best. Time Out Ohio. Okay, so client 1 was willing to participate in Time Out Ohio. He was able to exclude himself. If you don't know what that is, it's the old voluntary exclusion program. It is called Time Out Ohio. 1-5 lifetime is the amount of time that you can exclude yourself if you like, to treat your illness or what have you, to help with that possible slip. So he did that online 1 year. He has banned himself from all casinos, and we had lots of conversation about this, what that meant, what it didn't look like, how could it change, when is it going to change, what happens if you go to a different casino, because you can do that. You know, it all has to be what's going to help you manage, and he thought that was going to help him, so we went ahead and did that. I supported him with that. So work on financial literacy and building good habits by budgeting and family unspoken rules about things like money from stages 3. So PGNO offers this great stages training. It's 30 hours. And one of those was a lot about money and budgeting and unspoken rules and ideas that we grow up with in the family, which was very helpful. And then consider GamFin. GamFin is a free financial service right now, at least for our Ohio folks, to help with budgeting and kind of get a plan together to move forward. And then he used to call family every week or have a dinner with them every single week on Sundays, and they live about 2 hours away from each other physically. So although he was able to hide his behavior a lot from them from that reason, he also has been isolated more. So what he wants to do is resume at least phone calls once a week with his family members. So client 2, what we want to do for them is medication evaluation, just to make sure that those symptoms are being treated properly. The anxiety, the depression, especially, we want her to get the sleep that she needs, adequate nutrition, and exercise. So take medication as prescribed and consult with the prescriber on taking magnesium glycinate for sleep, which is an additional supplement that you can take, but you want to check with your prescriber, especially if you're taking something, but always check with the prescriber if you're taking something, and if it mixes with anything. So now on to treatment planning. What are we going to do with their treatment? So we've got client 1 is attending Brighter Days Wellness and Recovery on a hybrid schedule, starting 2 times a week. So hybrid meaning the barrier of him living 2 hours away physically from me. I agreed to meet him online as long as he was stable and using his safety plan, because it's not appropriate to meet online with people that have high risk situations like that. There's no way to manage it properly a lot of the time. So just use the resources that you have and use the right types of treatment. So we started meeting twice a week because of his high suicidality. We did that for I think two months or so, and then we dropped back down. So safety planning, removed all the weapons, finances were all put into the family's hands. That was something they decided to do, to take that off of his shoulders, because they wanted him to be less dealing with all these other issues and let him just focus completely on the gambling recovery. All right, so we're going to create new, introduce new and healthier coping skills into his life. Create new neural pathways for coping. Again, takes 90 days to create new neural pathways. Doesn't mean that those other pathways from 20 years aren't there. It means we just create new ones and then we have a choice. Do we want to do A or B? It's harder when you constantly do A, but we can do it and strengthen B. All right, so engage with sober support, GA, Gamblers Anonymous, Smart Recovery, or Gamblers in Recovery. I gave him a choice if he wanted support. And he did. He thought, I'd go check out GA. I know of a local GA meeting in my area physically. I also gave him some information about Zoom meetings, what times, showed him how to get online. We walked through that whole process. Client number 2 will attend Brighter Days Wellness and Recovery. She did weekly, and now she's coming, she started going 2 times a month. So regular Gam-Anon attendance. So this family member really loved the Gam-Anon. So Gam-Anon is like Al-Anon for the person with gambling related harms family members. So it's a 12-step kind of support group. It is for family and friends of folks struggling with compulsive gambling. So There is a local meeting, however, she did not want to go in person, so I gave her some information about online, and she has been attending. She actually does have a sponsor, and she still does. And she really enjoys that support a whole lot. She wanted to mingle with the community a little bit more, take more walks in her community, play golf twice a week, and explore new church homes. All right, so a little bit of information that I used with client number one. How did he get to where he was when he came in to see me? So we have pathways model, right? Pathways 1, 2, 3. With the full assessment and with meeting him in my experience, I believe that he is dealing with pathway 2, the emotional vulnerability, depression and or anxiety pre or post problem gambling onset. And he's using it also for coping. And we'll go over what that was. And we want to go over some ecological factors, cognitive distortions, and conditioning effects. So, it's not there, but emotional vulnerability, that's all right. So pathway 2 was depression, and there it is. Depression, father's death, and abandonment. So as we get to know each other, I know a lot more than I do in April, but in April, I know for a fact that he's already got depression in his history, and his father died in 2021, which is the big event that caused this emotional vulnerability for him. So the second part is these key ecological factors. So some key ecological factors are, let me get this, I can't see that one up there real quick. All right, so again, I mentioned client lives within 2 miles of the brick and mortar location in which he did his gambling at, right? So the location of choice, just right down the road. So any social norms, he has friends who gamble, but those friends that gamble are only people he sees at the casino. So he can only see these friends when he goes to the casino. Socioeconomic disadvantage. This is not a factor for the client, but it's actually reverse. It's the flip. And that is also common, the flip of folks having more of an advantage. And it comes with different types of cognitive distortions and CBT that we have to work through, the cognitive behavioral therapy model. Peer influence. Again, his friends are at the casino, and as they're sitting there, they're cheering each other on. Yeah, 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 go. So that's a great, fast-paced, lots of stimuli, that environment. Think about it. That's like everything at once that we want. So peer influence, that's what we just went over. Gambling marketing. He doesn't report watching, or he does report watching clients or other people on YouTube placing bets and gambling on slot machines. So for him, the marketing strategy is YouTube, right? He's watching YouTube. So cultural factors. Both this client and the family member denied any gambling as being a part of their family entertainment or a way to make money, which are sometimes factors for folks. Okay, so key cognitive distortions. Superstitious beliefs, relying on rituals or lucky charms to influence outcomes. So again, he won the $6,000 on this certain kind of slot machine that had these pictures and this different stuff. So that is what your brain stores to remember, oh, that's going to happen again, and it's going to be just like that. That's the same way that other substances get into our brain and let us continue to think that, you know, we're going to go back and we're going to experience that euphoria. So the superstitious belief is, I'm going to sit at this machine and I'm going to win again. It's going to be the same. A couple of cognitive distortions there, but overestimating personal skill, believing that the gambling skill is superior and he can beat the odds. Now, some of that was by sitting at the machine, I'm going to win eventually, right? But he didn't have any other overestimating personal skills that he presented to me. Illusion of control. Again, that's the same thing about the machine, brings the head back to that good time. Loss chasing. Client would go back or stay for multiple hours to win back money. So if he brought a certain amount of money, you know, and didn't have access to it, he would keep playing until he either lost it all or he won it all back. So I don't know how you win that way. You're losing, or you're losing. But we don't realize that as we're sitting there because it's so fun and the brain stores what it wants to store. So selective memory bias, right? That forgetting losses, never the wins. All right. Gambler's fallacy is the mistaken belief that losing streak means a win is due or vice versa. And that's really not true because you don't ever know when that machine, right, is going to win. You think you do, but do you? Some conditioning effects. Our gambling behavior is reinforced and increases the likelihood of the behavior that's repeated. So let's see if I can click on this. I hope it brings me back, but maybe it won't. Let's check it out. Look at that, operant versus classical conditioning. So this is important. When I was talking about that continued reinforcement on the brain, lots of us hear those stories about Pavlov and the dog that's salivating and mice in the environment that are trained to like a substance, right? There's so many different studies for that. It's the same thing, right? For gambling. So classical conditioning and operant conditioning are two important concepts. So classical conditioning associate an involuntary response and stimulus. Operant associates a voluntary behavior and a consequence. So let's take a look. Classical conditioning, again, first described by Pavlov, focuses on involuntary. We don't want to do that. So involuntary automatic behaviors involves placing a neural signal before a reflex. And operant, first described B.F. Skinner, who was the American psychologist, involves applying reinforcement or punishment after a behavior, focuses on strengthening or weakening voluntary behaviors. So this is really important as we take a look at how we're conditioned and how our response is with gambling treatment. Now I've got to go back. Let's see if I can do that. All right, look at that. All right, so some treatment interventions that we use for client number 1. We practice mindfulness, deep breathing, and vocal cord stimulation. So because of the anxiety that created the tic or the stuttering behavior, we want to stimulate the vagus nerve. The vagus nerve goes down the entire body. And when you stimulate that from the head, it reduces your anti-stress hormones. So we want to be able to do that, and it gives you more time. You know, your brain frees up, you're not in fight or flight, and you can make decisions. So instead of the autonomic nervous center being turned on, which it does when we're feeling anxious or afraid, because that's what our body does. It's put together that way for survival. We want to let the brain know that we're really not in danger. And that also works to decrease the anxiety. So practicing mindfulness, deep breathing, vocal cord stimulation, the stimulation of the vagus nerve to soothe anxiety, and it helps with that stuttering. And we did that every single time we met to help him stay calm. We did this online. When we did this online, we had to do it a little longer because he was more nervous online than he was going to do more stuttering online. So we just had to talk about that first so we could get it out of the way, cope with it, control it, manage it, and then move along with the rest of his treatment. CBT, cognitive behavioral therapy, to address thinking, feelings, and behaviors, and motivational interviewing to help move him through the stages of change. So even though he was in action when he got there because he no longer wanted to die and he wasn't gambling, what do we do with him? He can very easily go back into contemplation if he thinks things are okay right now because he feels fine, right? He doesn't want to die. He's not losing money. His family now knows. There's probably a little bit of relief. Now what? Which is so important about the pathways model, right? Why? What are we going to do with that next? So here we are. Positive affirmations are going to help. I'm going to go back to that in just a minute, but positive affirmations are a part of his treatment planning, interventions to improve mood and self-esteem. It takes 3 seconds to stare in the mirror and access your subconscious and tell yourself you love yourself, because you're looking for validation, and the validation has to come from within. If it doesn't, when that other person doesn't validate you or the machine isn't giving you money, where are you going to go? You got to go in here. So we have a safety plan. We removed all those weapons again, and we constantly looked at that safety planning. Did he need to use it? Did he want to use it? Did it need to be changed? Agreed to the Timeout Ohio for 1 year. I also asked him to join meetup.com, which is a social site for connecting folks with different activities that they like, different interests. Like if you like hiking, there's a hiking group. Most of them are all free. They meet in public and you don't have to give any personal information out. It is not a one-on-one. You go and you are in public and you just enjoy hiking, for example, and then you leave. If you want to go back, you go back. But this is going to get him into the world, we hope, and away from that activity that he has become his life, gambling. And slowly it robs you of everything, but you don't really realize it. So we've got to put these good things. He wants to be his old self again. And it certainly wasn't being at the casino all the time. So GA, Gamblers Anonymous, once a week is what he agreed to and thought it might be supportive. And then work through his grief and loss of father, because when he starts talking about that, he stutters more, and it is causing gambling urges. He doesn't really know a lot of this, right? That's why he's here with me. That's why we look at those pathway models. That's why he's coming to us for professional help, so we can help him stop this unhealthy behavior that is, could take his life. It's really important. So we want the psychoeducation piece to be there too, in any way that he can get it, and understand. It's so important to take continuous clinical scales and questionnaires. And it's so important because it's not only a tool for us that we collect the data, it's to share with your client, to show them how they've changed. Numbers don't lie. And we keep those for both of our sakes, right? We have to do that to show that we are doing the proper clinical assessing, but I think we don't really pay attention to how much it helps that client. All right, so we use with client number 1, that PHQ-9, like I talked about, the depressive scale, patient health questionnaire. On the 5th session, it was 15, moderate, severe. On the 8th session, it was 10, moderate. The 12th session, it was a 9, which was mild. So we can see, although not completely down, it's going down. It's decreasing. And then the anxiety related score. On the 5th session, it was 10 at moderate. At the 8th session, it was 9 at mild. And at the 12th session, it was 8 at mild. So the GSAS is the gambling severity. I gotta find the name of this one. I put it down there in my notes and I can't see it. Severity symptom scale. Severity symptoms, gambling severity symptom scale. It's one of those that are in between that can be done like the gambling index, problem gambling severity index. Okay, so on the 11th session, he scored 4 out of 48. It just kind of lets me know, is he still thinking about gambling? It's just different ways to have conversations with our clients instead of interrogating them and working with them as a team member instead of just this person across the desk at them. So client number 2, because we're not going to forget about her. She's still dealing with everything that client number 1 has, for the most part. So we do not meet together, we meet separately. We did meet 2 or 3 times throughout the course of treatment together. However, most everything was kept separate, which was one of those real life things, situations we had to deal with, was the financial piece of that and keeping that separate, which was, it had to be very rigid with boundary setting to do that. So let's go back to client 2 results, right? Her PHQ-9, you can see hers continually going down, excuse me. 3rd session was 10 moderate, 6 was 6 mild. By the 8th session, she was nominal, just like you or I, dealing with everything, right? And being able to manage and get back to her life. So anxiety, again, 3, the 3rd session, 9, 6, 5, 8, she had no symptoms of anxiety reported. And functioning, she was continuing to improve the entire time. So let's go on to treatment interventions for client number 2. For her, psychoeducation, CB2 to address thinking, feelings, behaviors of her own, and how her life and her symptoms were influenced by this situation. Was it independent? Or was this going to go away like the adjustment disorder, or was this something that was going to stand? Support group and other resource information for her. Traditional talk therapy was helpful for her as well. I introduced mindfulness to her through the Insight Timer, which is a free meditation app that I use with most every client who will download it. It is free and it's helpful, and I use it, and I can tell you how to navigate it and how it works for me. And again, it's a free resource. There are some things that you can purchase on there, but I've had it 15 years and have not done that. And it's been a wealth of information. So I showed her how to do that, helped her download it. Every step of the way, I helped them. So if she is 75 to 80 years old, she may not know how to use all of these electronics, right? So she brought her iPad in and I helped her put this on her iPad. I helped her download the Zoom on her iPad to be able to get to her Gam-Anon meetings. Anything that we can do for our clients, whether they're in front of us, we have to remove those barriers. And if you can't do it, then you find somebody to help them. If you can't, that's okay. But everything that we can do, we do. She did get a sponsor and is attending Gam-Anon. She did talk to the doctor about magnesium glycinate for sleep, and she was able to tolerate that and take that. Elevate, and Luminosity are two other apps that work for concentration, memory, focus. They offer free games every single day, different types of things to help with your memory, with concentration, with folks you might think are maybe having some dementia, but also healthier coping. And even though it may be an electronic device, it can be considered a harm reduction technique, right? They want to stay on that device, but they want to use more positive, healthy coping skills. Let's give them what they can get to. Spend more time with friends in her community, playing golf, working on jigsaw puzzles. She could just walk downstairs and do her jigsaw puzzle, right? All right, so client number 1 at this point attended 12 sessions. And I think over here it says 8 sessions. I'm not real sure. I can't see it because my face is cut off over there. But we're going to go back over to client number 1. 12 sessions. What has happened? What actions have happened in his life as a result of coming for 12 sessions? He showers every day because he was not showering every day. He was wearing the same clothes. His grooming was disheveled. And that's the mental status exam and why we take that, because we can look back and see, just like a clinical questionnaire, where was he at? What was his thinking like? Was he delusional? Was he suicidal? Was he depressed? Was he talking about being interested in his goals today, or was he not? Was he disorganized, right? We have to kind of assess all of those things. We are assessors all the time. He is dog sitting for his friends, which he loves to do. He loves animals. He loves these dogs and he loves his friends outside of the casino. He stays over at their place. He's no longer home alone a lot. He continues with his depression medication with no side effects. It's helpful. He's accepting trauma and working on grief and loss over his father's death. He was able to get into that a little bit, not too awful much. Every time we did, he said, "You got me. You got me." And then we'd have to close it back up. He attended some social events and laughs. I remember him telling me, "I forgot to be sad one day," right? He just forgot in the middle of this event. He went to go see his old not coworkers, but baseball coach and stuff. And he just forgot to be sad. And he was like, "I couldn't believe it. Caught me off guard." So that was really nice to hear. He was attending psychotherapy once a week by this 12 sessions. Okay, so client number 2, again, I think it says 8 sessions over there, attended Brighter Days Wellness and Recovery 1 time a month at this point. She's still doing her regular Gam-Anon, sponsor calls. She's mingling with her community. She's taking more nature walks. She's doing dinner with friends a couple times a month. She's taking her medication as prescribed, and she's returned to her regular eating. She loves cooking a big Sunday breakfast. She's returned to that. She's sleeping without magnesium glycinate and any extra influence, and the social activities she's back to by June. So diagnosis and updates. So for client number 1, we still have him with the same gambling treatment or diagnoses and the major depressive disorder. At termination, I diagnosed him with prolonged grief disorder, major depressive disorder, recurrent and moderate, and he still has this gambling. Although he is being removed from it. He has not gambled, at least by the time that I'm discharging him, which is just a couple of days ago, actually. He has not gambled, has not reported gambling. All right, client number 2, the only thing that she's currently still dealing with is adjustment disorder. It has not fully resolved, but it has almost resolved. She's still coming in once a month to see me at this point. Okay, so some family dynamics. So we talked about learning to address, these family dynamics. How did we do that? We did meet all together twice. Encourage the clients to talk to each other about, supposed to be finances, meetings, therapy, and family dinners. So the real life situation and the family dynamics, it got sticky when it came to the financial piece. I have not had a lot of experience with this particular, with somebody else paying for their treatment in this sense, but it needed to be done in order to see him. And it ended up working out okay. They talked about it, and then I didn't have to be involved. They worked it out on their own, but it was a little sticky in the beginning because you have to protect each person's confidentiality. And if client 1 doesn't want to come, but client 2 wants to pay, I can't disclose that. Right? There's a lot of factors there. I own a business, so I'm going to want to be able to see the client, right? I'm going to want to be able to do all these things, but my clients are first, not me. So I have to take all those things into consideration. And client number 1 gets to be empowered with managing his own treatment, have his own agency, his own autonomy. It has nothing to do with what I think he should be doing. The real world challenges, again, in treating this compulsive gambling disorder is his family member is really concerned that he may return to suicidal behavior or return to gambling behavior because he's decided to not come back to treatment, and that's really something that's a personal choice for him. The reason why I believe we identified pathway 2, we accomplished him not gambling, but we didn't accomplish the treatment of that emotional vulnerability enough. But it has been opened, I do believe, and he does understand that. We had a lot of conversation about, there was a fellow golf enthusiast who did commit suicide in the last, while we were working together, and my client had a lot of questions about that and wanted to talk openly and candidly about it. And so I do believe he will come back when he needs to come back. I'm gonna hope that because he actually called me his angel, which I wouldn't say that I am that, but that lets me know that I was there when he needed it. And I'm really glad that we're able to provide this gambling related treatment in our community. And we saw that, that map earlier that shows we don't have enough of us and we need more of us. So please continue to get trained, continue to ask questions, and don't give up. So on this last slide here is some resources, the Problem Gambling Helpline, 1-800-589-9966, and some different tools, the BBGS, the Brief Biosocial Gambling Screening, the Problem Gambling Severity Index, some different screeners for adolescents and for adults. So at the end, I wanted to share this little, this last slide. We just did a walk for Problem Gambling Coalition of Southwest Ohio, Out of the Darkness walk. We paired, because we know that the addiction that has the highest number of completed suicides is gambling addiction. So step by step we heal, shining a light on problem gambling and suicide awareness. And this is our tabling event that we had in September for Responsible Regulators Awareness Month that we're so grateful for our gaming environments in our Southwest Ohio partnering with us. And then me at my office, Brighter Days Wellness and Recovery. Thanks so much for listening today. And please let me know if you have any questions or if you'd like to contact me. I don't have that up there. That would be helpful. It is CE@brighterdayswellnessandrecovery.com. Again, it's pretty long. CE@brighterdayswellnessandrecovery.com. All one word. Thanks so much. Make it a brighter one.